Hello, I'm Dr. Png Keng Siang. I'm a urologist. Welcome to the podcast. Today we'll talk about testicular cancer.
How prevalent is testicular cancer?
Testicular cancer in general is not a common cancer. However, if you talk about in a young population, it is quite common, which we should all be aware about. Overall, the statistics say that it occurs in about 1 in 250 men in their lifetime. And overall, in males, it contributes to about 1 to 2% of all cancers in male. So again, not cancers that most people talk about. However, it occurs in the younger age group, usually men in their 20 to 40 years old. So for men in this age group, we are always reminding them to be aware of this rare cancer.
So, from your experience, right, how many cases have you seen?
In general, every year I see about 1 to 2. A very unique characteristic is that these patients are usually in the peak of their reproductive life, in the peak of their careers, of their family life. So when this diagnosis hits them, they are usually in a shock. And as you know, cancers tend to occur in older men or older patients. So when they hit them in these men with the prime of their lives, they usually are in a big shock.
Okay, so I guess how it manifests is really through a lump, for example. So, usually for your patients, how do they come to you? How do they actually detect it or know about it? Is it accidental or is it like really something that they do consciously look out for?
So yes, so a lump in the testis is definitely the most common presenting complaint. Sometimes the GP feels it. So, for example, the man would go to his GP or his polyclinic doctor for complaint of discomfort. May not be pain, but just something uncomfortable in the testis, and the primary care doctor feels something and refers it to me. Or sometimes the men themselves, or sometimes even their partners may discover a mass in the testes. So that's how they come to me. Again, like I mentioned, sometimes it could be discomfort or pain. However, testis cancer typically does not cause pain, as it's a silent growing tumor. However, if it does cause pain, it may be related to other conditions like infection. So during that time, we would take the opportunity to check the testes and make sure the testes do not have a lump as well. In the advanced stage, some men do not even know that they have a testicular cancer, but they actually come because their cancer has already spread and to other parts of the body. So they may have other symptoms unrelated to the testes, like swelling of the tummy, the problems breathing, pain in the bones, which suggests that the disease has already spread to other parts.
Is surgery the first line of treatment usually?
So depending on the stage or how advanced the disease is, in general, the first thing that we do upon diagnosis is to confirm that there is a lump in the testis. So I would always ask for an ultrasound of the testis. This is a painless procedure. Many patients are familiar with ultrasound. So ultrasound will be able to see the testis in great clarity and also see how big and measure how much of the testis has been involved. The next stage usually we would do is to do a CT scan, meaning to find out if the cancer has spread to other parts of the body. And also we will do some blood tests. Blood testis cancer secretes specific cancer markers. So we would see how high they are in the blood. That will also suggest how advanced the cancer is. So if the cancer is still limited to the testis, yes, usually the first line of treatment is surgery. And by surgery we mean the removal of the testis and also the blood vessels that supply the testis. So this is actually a very minor surgery. Doesn't enter the abdominal cavity, so it's just a small cut in the groin. However, I'm aware that many men are very concerned about this surgery because, as you know, testis is a very personal part, a private part of the body. So many men do have a lot of reservations about this surgery, and understandably so. In very rare circumstances, we may be able to avoid the removal of the entire testis if the lump was discovered in a very early stage, say if it's less than 1 cm or it's in a very localized part of the testis, then we may be able to discuss the option of what we call a partial orchidectomy, meaning we only remove part of the testis. However, it has some disadvantages. So we'll discuss all these options with the man and what's the best for its treatment. However, if the cancer is detected at a very advanced stage, then the priority will shift towards reducing the bulk of the disease in his body. And this is when the surgery would take a back seat first, and perhaps chemotherapy or radiotherapy would be more important upfront to treat the patient first before we go for surgery.
So is it precautionary to remove the other testicle as well? Is that sometimes done?
So during the evaluation, if the other testis is normal, no, we do not remove the other testis. So however, after having treated the affected testis, and the patient is in remission, yes, we do look out for the other testis, the other normal testis, because the other testis is at risk of um, cancerous change in the future as well. So, in fact, that is one risk factor for testicular cancer. If someone had testicular cancer in one testis previously, the remaining testis is at risk of developing cancer. Yeah, but we generally preserve the normal testis as much as possible for sexual reasons, for reproductive reasons, also for hormonal reasons, because the testis has all these functions as well. Besides removal of the testis, another role the surgeon contributes to the treatment is the role of removing residual cancer after chemotherapy. And that's usually in the stage 2 or even stage 3 setting. So this occurs when after the chemotherapy for disease that has spread to the lymph nodes in the abdomen, then they still find residual tissue in the lymph nodes. So sometimes there's a role to removing these lymph nodes through surgery, what we call retroperitoneal lymph node dissection. This is a major surgery which involves removing all the lymph node tissues around the large blood vessels called the aorta and the vena cava, because that's where the testis cancer spread to from the testis. And this is despite the chemotherapy having shrunk most of the cancer. So apart from being a major surgery, sometimes in this day and age, we can consider minimally invasive surgery for RPLND, the short form for retroperitoneal lymph node dissection, in suitable cases. We can either do laparoscopic surgery or robotic surgery to remove these residual lymph node tissues. So that would decrease the side effects of major surgery with faster recovery and less pain. The main side effects of RPLND is the effect of ejaculation. So the nerves of ejaculation, which is important to young men who are still sexually active, around the large blood vessels. So we have to be careful not to injure these nerves. And if the nerves are indeed too precarious, too close, then the man may not want to undergo this surgery. However, in most cases, we can remove the lymph node tissue carefully without injuring these ejaculation nerves. So that's the side effects of RPLND. As for the side effects of the testis removal, as mentioned, it is actually quite a minor surgery. No major side effects. However, the psychological side effect of removing the testis cannot be understated. After all, it is a very personal part of the man. Therefore, I do counsel extensively to the man what to expect and what are the implications of removing testis. Number one is, of course, the fertility. Not just the fact that the testis is removed, but in many men, they may undergo further radiotherapy or chemotherapy, as mentioned. So these certainly have side effects on fertility and therefore the ability to have children in the future. So sperm banking, so to speak, is one option that I will discuss with men, and a lot of them do take up that option of freezing their sperms first before undergoing further treatment like chemotherapy or radiotherapy. So fertility side effect is one. The other issue that I discussed with them is, of course, the psychological effect of losing one testis. And in this modern era, many men are open to the option of inserting a testicular prosthesis. Testicular prosthesis basically is like an artificial testis, which is basically a silicone prosthesis shaped like a testis. It comes in various sizes, so we would match the prosthesis to the patient's other normal testes so that both are similar in size. And the insertion of the prosthesis can be done at the same time as the surgery to remove the testis. So more and more, my patients do request for the prosthesis to be inserted at the same time when I remove the testis. So it gives them a better sense of well-being, and also they feel more cosmetically adequate after the surgery, and they don't feel like something is missing. So I think that is a good option for the young man. Testis cancer usually occurs in the young men, 20 to 40s, whereas the prostate cancer occurs in the opposite age group, which are men above their 50s, 60s. So usually they don't occur in the same age group. The cause of testicular cancer and prostate cancer are different from the biological sense. Prostate cancer is in general caused by environmental causes and things like that. However, testicular cancer has a little bit of a heritable cause of it. So another risk factor is family history. Maybe one important risk factor that I should mention is undescended testis. Okay, so this is usually not known to the men. However, when I ask them, I usually ask them, did your parents tell you that you had a testis surgery when you were young? So what is undescended testis? Is testis comes down from inside the abdomen in the fetus, and when they are at birth or up to 1 year of age, then it goes into the scrotum. However, in some babies, these testes do not go down to the scrotum, and they stay either inside the abdomen or they stay somewhere in the groin. So this is an abnormal position of the testis. So this is what we call undescended testis. So these testes in the abnormal position are prone to cancerous change because they are in an unusual environment while they were in the fetus or even when they become adult or a child. Yeah, so even if they had undergone a surgery at birth or when they were baby to bring the testes down to the scrotum, they are still at risk of having testis cancer down the road. So in fact, when we do undescended testis surgery, we do tell the parents, tell the boy that they must look out for testis cancer in the future as they enter adult life.
This condition is usually detected by
So all baby boys at birth are screened for these undescended testes. So like when you're born, the pediatrician would check the baby, make sure the boy has two testes. If not, they will definitely ask the parents to bring the boy for follow-up. And by 1 year old, all boys should have their testes in their scrotum. If otherwise, may need to do some surgery to bring the testes down. I think the learning point is that testis cancer is still overall very treatable, no matter at what stage. If it's like stage 1, a surgery alone can kill up to 80%, meaning only 20% or even less, the cancer comes back. So I've treated men in all stages. For example, stage 1, recently I saw a patient who had testes removed 5 years ago, stage 1. So he decided not to go for chemo, not to go for radiotherapy. Quite a wise choice. So he had a normal life for 5 years. But 5 years later, he saw me and the testes did come back in the lymph node in the abdomen. So I removed the lymph node and he went on to get some chemotherapy because it's proven that he had testis recurrence. So he had 5 years of normal life. Now he came back we removed the one lymph node and we gave the chemo, and he will still have a 90 to 95% cure rate. Okay, so even if you remove the testis alone, he will still do well. I also have patients who decided to go for chemo upfront, remove the testis, get the single dose chemo because he wants to have peace of mind. 99% cure rate, 99% mean he's almost cured, and he can get on with his family life, get on with his career. So I think that's also a wise choice. You get one dose of chemo and you probably will be okay for the rest of your life. Then, of course, you have those that present very late, they recur and they get cancer here and there, but they still live. And probably the most famous survivor we know is Lance Armstrong, the Tour de France champion. It's open knowledge, and he wrote it in his book that he had chemo, he had surgery, and I think he still he proves that he still can go on and do great sporting achievements even after good treatment.
So the recurrence rate, you say, is safely, we can assume that it is 1%. Is that like a safe percentage?
That's after adjuvant chemo or radiotherapy. Yeah, so the recurrence rate is very low. As much as we ask women to do breast self-examination, men, especially young men, as soon as they enter their teenage years or young adulthood, they should be taught or be aware of testicular self-examination. I hope the men can be more aware and start doing their testis self-examination soon. For any more questions, please do not hesitate to contact me at Farrer Park Hospital.